Hi all, welcome back to our channel Ach'z. So today in this section I thought of discussing about the upcoming OET exam date, that is 26th April 2025. What you can expect in your OET exam and how you need to prepare for that particular test day. So I just included a 15 days study plan from April 10 to 25, how you need to arrange for each and every skill modification. Also, I will let you know about the area you need to focus. That means under each and every skill, what all are the topics you need to practice with. So let's start with our section without any further delay. So prior to that, nowadays many students find difficulty during their role play section, that means during their speaking section, to construct the phrases or even to open up in front of the examiner, because they are not using English language in their day-to-day life. Maybe they are on ear break, or sometimes they are using their mother tongue rather than English in their professional life. Some others, even though they are under any institute or they have a speaking partner also, they are not getting enough exposure. Or even if it is group classes and all, means sometimes the teachers can't able to give more attention towards individual students. That time also they are not getting enough exposure. So I like to recommend an application, that is an AI application called Sparky. So here you will get the real-time conversation and you will get the feedback. What all are the mistakes you made? What about the grammatical error? What about the spelling errors? What about your pronunciation mistake, or how you need to modify your English language? You will get the exact feedback from your AI friend. So here you go. From your Play Store, you can download the application, and with your Google, you can just register, select your mother tongue, your age, and they will make an analysis about your current level and about your area of interest. Based on your interest, you can select the topic which you need to talk with your AI friend. So here comes the Sparky. You can just talk according to your wish. It helps you to improve your English language proficiency. If you need to record your voice, yeah, you have the facility to do that. You can adjust the background music. You can talk according to your wish.
Hi. What's your dream job, Leo?
My dream job is accounts receivable in healthcare industry.
That's a well-structured response, Leo. You're aiming high. What interests you about accounts receivable in the healthcare industry?
Because accounts receivable main job role is speaking English.
There are so many free sample topics, and also if you take the subscription in the offer prices, you will be accessible to the range of topics, which definitely helps you to boost up your confidence if you're talking in front of others, and also in your English proficiency exams like IELTS, even OET or PT, whatever you are appearing for. So you can just practice using different games and you can see different videos. So what you're waiting for? Just download the application. So I hope you can make use of this application and improve your English language and grab your dreams as soon as possible. Now, without further delay, let's start with our section. By last, I will let you know about the 15 days study plan. First, we will just discuss about some prediction, or especially under writing and speaking, many students find difficulty in, which are the areas you need to focus on. So first about though later, this time you need to give more importance towards a referral letter and the transfer letter. We'll discuss some topic also or some scenarios under referral letter. First one is elderly patient with recurrent falls and hypertension referred to a physiotherapist. That is the first scenario you need to prepare with. Second topic, diabetic patient with a non-healing foot ulcer referred to wound care clinic. Third one, pregnant woman with gestational diabetics referred to obstetrician. Fourth one, child with persistent asthma symptoms referred to pediatrician or asthma specialist. Moving further, middle-aged man with high cholesterol and obesity referred to dietitian. Then next one, patient with the depression and anxiety symptoms referred to mental health nurse or psychologist. And the last one, teenager with eating disorder signs referred to adolescent mental health services. So these all are the topics you need to concentrate under referral later. Next, we will discuss some topics under transfer later. So the first one, stroke patient being transferred to a rehabilitation facility. Second one, palliative care patient being transferred to hospice. Patient with fracture transferred to ER or to orthopedic unit. Then dementia patient transferred from hospital to residential aged care facility. And the last one, psychiatric patient transferred from general hospital to mental health facility. So these all are the topics you need to concentrate under transfer later and even referral later. Okay, I hope you are clear with the topics. Next, we will move on to the speaking section. So we will discuss some scenarios under speaking role play cards. So the first one is medication education. So under that you need to explain how to take antibiotics or the inhaler. They are new to the inhaler means how to use that, or educating about the insulin administration to a new diabetic patient. And the second scenario is lifestyle advice. Under that, the smoking cessation advice to any long-term or chain smoker. Then diet and exercise related guidance to the hypertensive or diabetic patient. Then the third one, post-operative instructions, explaining the wound care after the minor surgery or advising on the mobility aid after any hip replacement or the knee replacement surgery. Next scenario, fourth one, is an emotional reassurance, speaking to a worried parent. If the child having fever and all means parent is worried about the condition. So talking and reassuring the parent. Then calming an anxious elderly patient before any procedure. So mainly this reassurance related scenario will be related to the parent of a child or elderly patient or the bystander of elderly patient. So try to construct some phrases based on that. We already updated some common phrases you can use under different scenarios. So you can just go through the playlist if you find difficulty in. Then the next scenario, communication with non-English speakers, simplified explanation to a patient who has a difficulty to understand the language, or demonstrating the empathy and patience. So these all are the 5 different scenarios you need to concentrate under speaking module. Now we will discuss about some reading topics you need to focus more towards, especially the part A, where the students are always anxious about. So I like to recommend some topics. So first I like to recommend some topics you need to or you must practice with under part A section. First one is diabetic mellitus type 1 and type 2. Second one, chronic obstructive pulmonary disease, which means COPD. Third one, congestive heart failure or about the myocardial infarction. Fourth one, stroke. Next one, asthma. Sixth one, urinary tract infection. 7, hypertension. 8, dementia or about Alzheimer's disease. 9, about pneumonia. 10th one, respiratory infections, or they can ask about this COVID-19. Then 11, deep vein thrombosis or DVT. 12th one, Parkinson's disease. 13, anemia, especially iron deficiency anemia. 14, palliative care or about the end of life care. 15, epilepsy. 16, hyperthyroidism or about the hypothyroidism. 17, osteoarthritis. 18, gastroenteritis or about the dehydration. 19, depression or anxiety. And 20, tuberculosis. So these all are the topics you must prepare with. You will get enough time. At least you can just complete two of the topic in a day. Now, I like to recommend some Part B topics, workplace safety procedures, examples like the use of PPE or handling the sharp, then patient confidentiality and the documentation guidelines, then nurse handover notes, then hospital protocols for this fall prevention or about the waste management, then internal communication about the infection control, and the medication storage and the disposal policy, especially the narcotics or the high risk medicines and all. Now, coming towards the part C, the long test. So, here you will get to the portion of any journals or reports or the interviews and all. So, some part C topics we will discuss. The advances in the nursing role, like the nurse practitioner or about the telehealth and all. Recently, also they are keep on asking about this telemedicine, telehealth and all. Then mental health in healthcare workers, about this antibiotic resistance or the overprescribing of antibiotics. Then cultural competence in nursing care, palliative care communication challenges, childhood obesity and the nursing interventions. Then by last, the chronic disease management like the asthma or COPD. So these all are the areas you need to focus under reading module. Now we will discuss about the last module, listening. I hope you all know about the structure, what you can expect in each and every part. In part A, you will get to the conversation with the expert like the neurologist or the gynecologist or GP with the patient. So you will get to the two different conversation, that is clinically focused conversations. And in the part B, you will get to the short workplace related extracts, that may be the briefing or any memos or the handover. And in part C, you will get to the long monologues or like any presentation or the interview. Okay, so that's about the structure. I hope you all know about that. Now coming towards the part A section, the likely topics, managing the asthma in a young adult or elderly patient with the memory issues or confusion, or about the post-operative pain or the wound care related discussion, or the parent is concerned about the child's fever or the rashes. Then a patient with anxiety discussing about the side effect of any medication, or the diabetic patient struggling to control the glucose level, or that may be any consultation before the surgery also about the preoperative preparations. Coming towards the part B section, so here you need to concentrate on the attitude or the purpose, that is the area you need to focus towards. So the likely topic like a nurse to nurse handover or infection control update, protocols on any sharp disposal or about the PPE usage, then staff meeting on the patient safety, medication storage policy, or about the emergency procedure briefing also, like the code blue and all. So here you need to give more attention towards the tone or the voice modulation. Try to understand the intention behind each and every dialogues and expect some synonyms or paraphrasing of the things also. Now coming towards the part C section, here you need to focus on some inference based question or the opinion based questions. So that is the area you need to focus towards. Some topics about the advances in the telehealth, about palliative care, communication challenges, then cultural competence in nursing, about the burnout and the mental health in nurses, technology in wound care or the fall prevention, managing chronic illness in community settings, and to the last one, antibiotic resistance related discussion. So here you need to concentrate on the opinion, not on the fact, and practice identifying the speaker's attitude. Is that neutral or skeptical? What type of attitude? And improve your note taking for the keywords, especially the side effect or the causes and all. So these all are the area you need to focus more on. 26th April 2025 OET exam. Now, I don't want to make the video too long, so I just include one PDF for your 15 days preparation. That means a study plan for each and every module. So if I'm including that in the video, means it will be too long and you will get bored. So you can just download the PDF, take the printout, or just download the PDF and practice accordingly. So there I clearly mention how you can cover the all four skills in 15 days. That means from April 10 to April 25, how you need to schedule your time. So I hope that will really help you out to complete the section. I know that you all are not in the beginner level because you are planning to give your exam this month. So definitely you are in the intermediate to advanced level. So based on that only I arranged the study plan. So try to download and go through that. And as I mentioned before, you can make use of this artificial intelligence, AI applications and AI tools to improve your English ability. Okay, then you can practice according to your convenience and time. So that's it. All the very best for your OET exams on 26th April 2025. Soon after the exams, we will come out with the review or the question paper discussion. So if you're planning for next month or the upcoming months also, try to watch out the guide and also the review section. That will also help you out to plan your study time, and you can somehow predict what to expect in the real exam. So all the very best and God bless you all.